Why should a doctor press your muscles during an exam? So the clinical exam is a dying art. Many people have turned to more technology than anything else because that's kind of objective. But the clinical exam, where you're pressing on muscles, does a lot of different things. On the simplest level, it establishes the bond between the doctor and the patient because now the patient is consenting to let their body be examined. And there are people who don't trust enough to allow that to happen. So as clinicians, we want to know who those people are so we don't violate their space. The next thing is, pressing on muscles can show us if there is trigger points. Now, trigger points can be active, where you touch them and you feel something and the person feels pain. There can be trigger points where you press them, the person feels pain in that area, and the same pain shoots down the arm, the leg, or into the face. You can have a trigger point that gets pressed and they have a pain in the same area and the pain shoots up into the face. You can have a trigger point that gets pressed and it makes a numbness in the finger while you press the trigger point. Many times I've seen people, if they have trigger points back here on the left side, if you press, they start burping uncontrollably. So all these things tell us how far along in the process these people are, because many people come to a doctor when they're in really bad shape. Otherwise, they'll have gone to Ayurveda, physiotherapy, or a variety of doctors who don't understand the musculoskeletal system, like neurology, ortho, and neurosurgery. So having done all that, we have to understand how bad this process is and how we can get to a solution. But the first part is always a clinical exam, because if you want to help someone, they should trust you. If they trust you, they'll let you touch their body. Now, most of the time, these trigger points will be found in relatively non-specific areas that can be found here on the back. But as a physiatrist who treats pelvic floor pain, you can find trigger points inside the pelvic floor also. For a person to improve, they should know that we're trying to help them, and for that, they should consent to an exam. So the physical exam is one of the most powerful tools we have after just getting a regular history from a person.